No, doctor.
Mm. So you told me that this is all over your chest and maybe a little bit to the left, but do you think that this pain radiates somewhere?
No, doctor. It's just on the left of my chest, nowhere else.
Okay, okay, that's good. So John, can you please tell me, do you notice any maybe swelling somewhere in your body, maybe in your legs?
No, doctor.
Okay, that's good. Do you have any changes in your waterworks?
Waterworks. No, doctor.
Okay, that's good. Can you please briefly guide me through your general medical conditions? Do you have anything I should know about?
Journal med. No, doctor. I really don't have any illness. I'm just 25.
Yeah.
But I had this flu and fever like 10 days
Uh-huh.
ago, for
Uh-huh.
which I took some painkillers and some like pills for the fever.
Uh-huh. I see. But now you don't feel like you have you're feverish or you have any signs of this infection.
No, it's
Okay.
just the chest pain now, doctor.
Okay. So no sore throat or maybe cough, something like this.
No, doctor.
Okay, that's good. Okay. And did you have any, do you have any allergies?
No, doctor.
Okay. And did you travel somewhere recently?
Traveled. I traveled to Turkey like 3 months ago.
3 months ago. Okay. Okay. Thank you for sharing. John, can you please tell me, what do you do for living?
Well, I work in an office. It's industry type, and I am the HR manager there.
Okay, I see. And who do you live with?
I live with my girlfriend, doctor.
Okay. And how is she? Does she have any problems with chest pain, something like this?
No, doctor. She doesn't have any kind of problem.
Okay. Okay, that's good. Just a few more questions. Can you please briefly guide me through your lifestyle?
Okay, lifestyle. So, doctor, I usually work from 9 to 5. So after that, I really get time for any kind of workout. Sometimes I go to the gym
Mm-hmm.
on the weekends. Yes, I eat healthy, doctor.
Okay, that's good. And do you smoke or drink
No
alcohol?
smoke, but yes, I go drink alcohol on the weekends with my friends.
Okay, okay. I already understood that you are worried that it might be a myocardial infection. It's very valid concern, and it will totally will rule it out. But do you have a part of this any other concerns?
No, doctor.
Okay, and any ideas of your own what might be the reason of this pain?
2 minutes remaining.
No, doctor, I really don't know what's happening. I think maybe this is some kind of heart attack.
Yeah, I understood this totally. Okay. So, John, I would like to examine you. I would like to take your vitals, to take your oxygen, to measure your oxygen, your temperature, breath rate, and so on. Also, I would like to perform a general examination of your chest and of your lungs. I would like to listen to them. And also, I would like to check your heart. Also, I will check your legs for edema. Okay. And yeah, okay. And I would like to do, okay, I will tell you. Okay, so John, from what you told me, and I would like to do an ECG.
Okay.
Okay. What is
So
an
is
ECG?
widespread ST elevation.
Mhm,
It would be saddle shaped,
mhm. Okay.
and the observations would be normal. The patient would be having a heart rate of 100.
Okay. So John, from what you told me, I think you might have a condition called pericarditis. Have you ever heard about it?
No, doctor. What is it? It's some heart condition. Severe?
It is a heart condition. It's an inflammation of layers of the heart, but it's a completely different from myocardial infarction. Okay.
Okay.
Let me explain you. So usually it is a self-limiting condition, but we have some drugs to help you with it, like anti-inflammatory drugs. If they won't help, then we will give you another one, like colchicine. But for now, we'll need to uh, uh, leave you here for other observations because we need to wait to do some blood tests, like routine blood tests and heart especially enzymes of the heart. So we need to rule out anything serious for sure, just to be on safe side. Okay.
Okay.
So I will consult with my senior.
Move on to the next station.
Thank you.
Yeah. I again didn't have time to finish.
So what do you feel about the station you
Sorry.
what do you feel about the station you just performed?
Yeah, I feel that again I didn't have enough time. I hate myself for the question about waterworks. What was it? Why? For what? Why did I ask it? I asked it and felt like, what? Why did I do it? So yeah, I didn't. I have. I think even with you, we were discussing this pericarditis because I have this situation with pericarditis that some academies say that we need to admit, some academies say that we don't need to admit. So for now, I'm up to this idea that we just leave him for observation to rule out everything. But I didn't mention like yeah, what didn't I mention?
Okay.
That I would like to have a consult from cardiologist, I was going to say, and yeah, some follow-ups with GP, I think.
Okay, all right.
Sometimes I think I could say that cardiologist might assess you and think maybe he'll need to do some blood cultures, maybe start you on antibiotics, but generally it's self-limiting condition. You'll just need anti-inflammatory drugs and maybe later colchicine. And if it doesn't work, we might start you on steroids, but it's too long.
Okay, great. So you know the scenario. So basically, in your consultation, it was overall a good consultation. You were doing really well. You took the history. A bit of empathy was missing. Like a patient is there with like chest pain. So you have to change a bit of your tone. Oh, I see you are in chest pain. So how are you feeling at the moment? By any chance, do you feel stressed when this pain started? So maybe sometimes a patient is in stress. So you have to ask about any stressors in life as well. You have to ask this question. Other than that, like you got to know that this was pericarditis when I told you the worsening and the relieving factors.
Mm-hmm.
Yes, you knew about the diagnosis at that point. So you went for the you didn't ask about recent viral infection. So
Yeah.
I would suggest instead of asking about like waterworks or something like this, so you can ask, by any chance that you have until so you can ask that. Other than that, when you get a chest pain station, basically the first thing what you do is to rule out MI, angina. These are the like red flags. So you have to talk about that. So ruling that out, you talked about breathing difficulty. You talked about you have to talk about heart racing as well. Any chance you feel any heart racing, any cough, any breathing difficulty, any fever? So you asked almost half of them. So that's good. Other than that, yes, you have to ask about trauma to rule out any musculoskeletal chest pain. So yes, you need to know your differentials when you are ruling out a chest pain scenario. That I have to rule out, like talk about any rash on your body to rule out shingles. So these are the things which you can ask about. Did you ask about is the pain going anywhere
Yes, I did.
else? Okay, yes, you asked about it. I said it's just in my chest. Yes, this it was okay. I was waiting for the examination part. But you asked about the ECG in the end. So yes, ECG bedside ECG is important, and you have to tell the patient we are going to take. I'm going to admit you for observation, and we are going to run some serial ECGs after like half an hour on an hour. We are going to ask the specialist, the heart specialist, who's going to come and view like see you, and so that we can get a better picture of what's really happening. But for now, I believe that you are having what we call as pericarditis. Have you have any idea about it? So no, doctor. So it's basically the inflammation of the outer layer of the heart. And as you told me that you had this viral infection few days back, so this can be one of the causes of pericarditis. And pericarditis can be triggered by any recent viral illness. And but the good news is that, John, this is like you have to use the patient's name in the scenario. The patient's name is given for a reason. You ask for the preference for a reason, that you have to use the patient's name to build the doctor patient relationship. So you have to say, so John, the good news is that this is self limiting, and it's unlikely to be a heart attack, so you don't need to worry about that. We are just going to run some examinations. We are going to do some cardiac enzyme tests, and after the ECGs, maybe if we see anything other significant, then maybe we can go for chest x-ray as well. Would that be okay for you? Yes, doctor. So for now, I'm just going to prescribe you some NSAIDs, maybe some ibuprofen, which is the first drug which we give in this condition. Would that be okay for you? Yes, doctor. If it's not happening, then maybe we can switch to another drug. And if we see that a lot of fluid is filled in your needle. So yes, you can talk this, and you feel that if this pain is getting severe, just call 999. So yes, this is how you perform. Otherwise, the station was good. Your history taking was good. Just a bit more like things which I've told you. You can add that, and you're good to go.
Should we do an when in which situations we can do X-ray before talking about diagnosis?
So basically, bedside X-ray, usually it doesn't happen everywhere. The basic investigations which you can do on the bedside is urine dipstick. You can check blood sugar. You can check the ECG. These are the basic tests which you can do on the bedside. X-ray, I don't think, I haven't heard that there are bedside X-rays, but obviously it's not going to happen at the moment, because like for doing an X-ray, you have to keep the patient in a position, you have to adjust the patient, and then you have to go through the protocol and everything, even on the bedside, even back home when there is a bedside X-ray is going to perform. So it takes like a lot of time, like 10 to 15 minutes, and don't really have time in the station.
I understand it. Just I mean, so in the stations where it's important for us to have X-ray, like where it is pneumonia and tuberculosis and the cancer of lung cancer. So
Okay.
there's the stations where they will give us an X-ray. So I only ask for X-ray after the telling the diagnosis.
Shall I add something? If sorry to interrupt you.
Yes, sorry.
Yes. Hello.
So the X-ray, usually you can order X-ray, but in the same menu will say portable X-ray. But in this case, possibly in this case, if it's just a pericarditis, patient is not sick, just say that we'll do some markers, troponin, series of markers if we need to repeat, if they are elevated. So then we'll repeat. Ultimately, we'll be sending you home after observation, after repetition of marker. And because I've seen a lot of patients coming with pericarditis, if they are not unwell, so you can send them home, okay?
Yeah.
So that's the thing. And because it's just an inflammation. And regarding the culture and antibiotic, that's not pericarditis. That is endocarditis you're worried about. That you can do safety netting about that. At that point, you can say the cardiologist. Cardiologists not need to see this patient anyway. ECG and troponin level is all right. So the patient is going home, but you're keeping him in for observation of the repetition of troponin level if they are elevated. So you can say that if they will give you that. It's all right.
They will say like keep under observation. So we don't say admit.
No, you observation is all right. Okay. So regarding the X-ray, if you are in the A&E, yes, you can order X-ray anytime because it won't take longer. The patient can walk, and the X-ray portable X-rays are also available. But if the patient is very sick in cement, then you will do portable X-ray. Otherwise, not.
Okay, thank you. And last question: in this station pericarditis or MI, can I take about taking troponins before the diagnosis or only in management part?
No, I haven't heard of any of the station in which like the examiner is going to have.
Sorry. So in this station, we don't have any indication at the moment. Okay, but if you want to do, and you want to, by saying that, not better. The point is that few of investigation would you like to add before making, if you are in the A&E setting, you can say as many investigation you want, depending on the case. For example, in this case, if you are worried, the patient, you want to see the size of heart or something like that, you can give you results. Okay. So that's the key. That's the key here. All right. So you can, there is no harm of saying that if you want to do X-ray, but results will not be available, like Ramesh said. So you can say that, but results, most of the cases, results will not be available. Like you will do mesothelioma, you will do TB, they might give you results, but not all the time.
Yeah.
But you can verbalize after diagnosis. Okay.
Okay, thank you.
Also, the diagnosis is basically the provisional diagnosis, what we are making in lab too. So these diagnoses are a suspicion of what the patient says and what the observations and examinations are. That's not a confirmed diagnosis. You always say, I am suspecting, I am suspecting. You don't say, this is, I am diagnosing you. So this is not what you say. So basically, after the clinical history, you just suspect that this is the condition, what I am suspecting, but we are going to run some investigations. So this is it. Yes.
Okay.
Do you have any?
No, I'm done. Thank
Okay.
you.
Welcome. Thank you so much. So Subhan, do you want to say anything?
Yeah, regarding her history part, the structure she followed it wholeheartedly. It was very good, but again, a little bit of changing tone and empathy and IPS can be improved a little bit more. And regarding that X-ray part, so recently when I gave my exam, I had this musculoskeletal pain, and I verbalized by that part that I would like to do the X-ray. And they gave me the X-ray findings of that condition, that there are nodes in the long feathered sternum. So you can verbalize that you can, I need to do a chest X-ray as well. So because I verbalized that, they gave findings of X-ray as well.
Okay. So basically, in the cases in which we think that this is going to be the diagnosing, like any investigation, we can mention in that. For example, even in pneumonia, I don't think that X-ray is needed to be done beforehand. We can diagnose pneumonia on the basis of clinical history. We can like do it on the basis of even blood counts as well. So, but in musculoskeletal, obviously, when you have to go for the X-ray and then you see the findings. So yes, there are few of the scenarios which require X-ray. You regarding the trop level, you can ask about the trop levels in MI or angina, because that's needed. So we can get results in like that kind of scenarios. Otherwise, pericarditis or other scenarios don't need trop levels.
Yeah, so it depends, it varies case to case. So if you're suspecting that the pathophysiology, it can be a traumatic cause, then you can verbalize the imaging that I would like to do this imaging. And if that is the case, that like traumatic, the cause of the disease is a traumatic one, they will give you the findings, image findings of that condition.
Indeed. So yes, let's move on to scenario.
Yeah.
Would you
I
like
think,
to give?
Sorry.
Would you like to give one to anyone who is on site?
Yeah, Dr. Ala is here. She wants to do one from CVS. So
Okay.
you can. So let's give her one case from CVS. Right. Yeah.
Hello, guys.
So
Hello.
Dr. Ramesh, will you like be the patient, or should I be the patient?
Well, you can be the patient. I can give the scenario if you want.
Okay, sure.
Okay, let me open the calibration. Okay, so Ala, you would be an FI2 in the GP surgery. There would be a patient, Ian Smith, 70 years old, who has presented with chest pain. You have to assess the patient and discuss the management with him.
And the name is
Ian Smith.
Ian Smith.
Ian Smith. Right.
I've texted you the diagnosis.
Okay. Yeah, I'm the patient.
Do you know the condition?
Yeah. So I will also bring on the timer. Okay. So just tell me when you're ready, okay?
Ready.
Begin.
Enter the room.
Hello.
I'm Dr. Kosova, one of the doctors in the GP clinic today. May I please ask for your name?
I'm Ian Smith, doctor.
All right, and how old are you?
I'm 70.
Great. What would you like to be called?
You can call me Ian.
Ian, that's great. First of all, thank you for coming. What brought you to the hospital today?
Oh, doctor, I'm having severe pain on my chest.
Right, okay. For how long do you have this pain?
It's been there for around a couple of weeks now.
Weeks.
Yeah.
All right, all right. Tell me more about this. I mean, how did it start?
It started gradually, but it's becoming worse now. It's unbearable, doctor. Do something for my pain.
Right, right. And have you tried anything to relieve this pain?
Oh, no, I don't know what to do.
Right. Could you describe this pain for me?
It's a sharp pain.
Sure.
Yeah.
And probably you could point where is this pain exactly?
Yeah, it's all over here on my right side.
Right. So you're
Yeah.
pointing on your right
Yeah.
side. Is it radiating to somewhere?
Yeah, it's going back.
To your back.
Yeah.
Right. So is it getting worse?
Sorry?
Is this pain getting worse?
Yeah, I told you it's getting worse day by day. Yeah.
Right. No worries. I'm here to help.
Oh,
Anyway,
thank you.
we'll get to the bottom of this.
Mhm.
So please bear with me. A couple of more questions.
Okay.
So do you have any chest pain? I mean, like in
Yeah, it's on my chest.
Right. Yes. Any pain in your legs?
No,
No. Any headache?
no,
Right. Any weakness anywhere on your body?
no, doctor. It's just a pain on my chest. You
Right.
do something for it.
All right. So I will definitely examine you
Mm-hmm.
a bit later. And just to ask, have you noticed any fever?
No, I don't.
Mhm.
I haven't noticed, but I feel like a little bit warm.
Warm.
Yeah.
In all your body or only on that area?
No,
which is
it's all
moving?
in my body.
All your body.
Mhm.
Right. Is changing, like when you change your position,
Mhm.
have you noticed which position is like worst for you or which is relieves this pain?
Yeah, it increases when I'm lying on this side.
Okay, all right, all right. Have you had any medical conditions before like this?
Like this, no, it's the first time.
First time.
Yeah.
Do you have any medical conditions?
Yeah. I was diagnosed with diabetes for like 30 years ago.
Right.
Yeah.
And how you coping? I mean, do you take any medications?
Yeah, I
for
take
this?
insulin for that.
Do you take them regularly?
Yeah, I try to.
Okay, so it's stabilized and no sweating, no other symptoms of your diabetes.
Oh, no, I don't think so.
All right, that's great, great to hear. And do you have any allergies at all?
No.
Okay. And apart from your diabetic medications, do you take anything else?
No.
All right, that's great. And just a couple of questions about your lifestyle. Do you smoke?
I used to smoke, but I have quit smoking like a couple of years ago.
Oh, that's great. Well done. Anyway, it's very good. You know, smoking is very harmful.
Yeah, that's why I stopped it.
Do you take any alcohol at all?
No.
All right, all right. Now, do you have any specific expectation about yourself?
Yeah, please do something for my pain.
Right, yes, that's understandable. And at this point, I would like to examine you.
Okay.
All right.
Okay.
So this would include your taking your vitals.
Okay.
And some specifically, I would examine your chest, your tummy, the presence of chaperone. Is this okay with you?
Yeah, fine. So there's a rash all over the chest, coming from back to up front.
Yes. Thank you for letting me know this. So do you have any ideas what might be the problem?
Oh, no, doctor, I have no idea.
Right. Thank you for letting me examine you, first of all. And yes, like from now what you told me, that you have this pain and it's going to your back, it exacerbates when you lying on this part of your body on your right side. And from what I've seen now, I suspect that you might have a condition which we call shingles.
What is that, doctor?
Right. So this is manageable and absolutely treatable.
Okay.
Nothing to worry about. Just you need to follow my recommendations and you will be fine.
Okay.
Anyway. So just a question, do you have someone, I mean pregnant woman who
no, doctor. It's just me and my wife living in the house. We don't have anybody like that.
Right. Does your wife have any medical conditions?
Yeah, she's also diabetic.
Diabetic. How is she coping?
Oh, she's fine.
It's fine, right. So, I mean, I'm asking all those questions because this is a condition which you can pass this bug, which we call.
Okay, so what do you suggest? What I do?
I mean, if you share showers, sorry, towels, or one bed, for example, you can pass to someone else this infection. That is why I've asked this. So please try to avoid like close contact to someone else, especially with your wife.
Okay.
2 minutes remaining.
And at this point, I would prescribe you special medications which would kill this bug. This is a virus. And you would take these medications 4 times a day.
Okay, which medication are you talking about, doctor?
This is acyclovir.
Okay, what does that do?
It would clean your body out of this like bug.
Okay.
It would last probably, so you would take this medication for 5 or 6 days, but the rash will disappear a bit later.
So do something for my pain.
I will prescribe painkillers for you.
Okay.
Have you tried? You've told me you haven't tried.
No, I haven't tried anything.
So we would start from paracetamol.
Okay.
Yeah, and if it doesn't help, we can give you additionally something else to relieve this pain.
Okay.
And if you have any other concerns, please let me know.
So you told me that I can pass this condition to my wife. Should we give her some medication so that she don't have this condition?
So at this point, she doesn't need any medications.
Okay.
But we have a program. People who are over 70 may receive special vaccination.
Okay.
Yeah, to protect themselves of this bug. If you or your wife are interested in this, also let me know, and we would make an appointment for your wife, yeah, to protect her. Is there anything else I can help you with?
Okay, and thumbs up. So thank you.
Thank you. Safety net.
Yeah, safety netting was important.
Move on to the next station.
So, doctor, I'm worried about infecting my grandson.
Yeah. Tell me, please, have your grandson, was he vaccinated against chickenpox?
Well, yes, he was.
So in this case, your grandson doesn't need anything special, and because he has immune system, it would like keep him healthy and safe.
Okay, doctor, thank you so much. So we get vaccination for like chicken pox, and then can't we have chicken pox?
If we have vaccination, if someone has vaccination, yes.
We can have the disease, obviously, but the severity is decreased. Like the disease is not going to be that much severe. So in this scenario, if the patient is concerned about the grandson, you have to ask about the chicken pox history. That did your child or did your grandson has ever been having, or did he ever have chicken pox in his childhood? How old is he? First of all, this question, and then did he have any chicken pox in his childhood? So if he had chicken pox in the childhood, then I'm afraid that like he won't this shingles won't be transmitted to him. But if
Yeah,
but if he hasn't gotten any history of chickenpox, of acquiring chickenpox in the in the childhood, then he is at a risk of getting shingles. And maybe first of all he is going to get chickenpox from the virus, and then he is going to get shingles, the latent one.
I mean, in our situation, how can we come to the grandson? So some information must lead us to this. So probably I had to say this is the virus. Originally, this is chickenpox virus, and then say, oh,
It,
it's chickenpox.
so you have to say that in the diagnosis part that this is a viral infection, and which is causing this chest pain, and this chest pain is due to this painful rash on your chest, I'm afraid. And basically I, can you tell me that did you have chickenpox when you were a child? Yes, doctor, I did have chickenpox. Right. So sometimes due to activation of this chickenpox, we can have this sorry, hello. So we can have this virus which we call as shingles, and this remains in the body for a long time, this and that, blah blah.
So
So
I
let's
had to ask,
sorry,
I had to ask, did you have chickenpox infection in your childhood? Yeah.
Yes, you can ask this after seeing the rash, but I would suggest you to talk about the rash history in the chest pain scenario. I would suggest everyone to ask about trauma and any rash on the body in the chest pain, so that you may know that the patient is having a rash as well. So you go take the scenario from there, so that you can ask about the chickenpox history in your history part.
Okay.
Okay, so let's hear from Saban first about your consultation, then maybe I can add something.
Yeah. First of all, it was a good consultation. Yeah, she did try to follow the approach, but asking about chickenpox history, that was a very good, important question. So I think you should never skip that again if you have the slightest idea that it might be shingles. One thing, and you didn't ask me severity score because I wasn't taking anything for my pain, and in order to decide what painkiller will help me better, you should have asked the severity score, and that will help you a lot. Because yeah, and then the paracetamol, I don't think the paracetamol will help in this case because the pain of the shingles is very severe. One thing, and in the management part, you mentioned that you will give acyclovir. So acyclovir is given when the patient presents within the 3 days of development of the rash. I told you that I have this rash for more than 2 weeks now. So at that time, symptomatic treatment will be of more help than the actual antiviral. And what's the symptomatic treatment? Can you tell me?
No paracetamol, definitely.
Yeah, but yes, exactly. Yeah, you can also prescribe amitriptyline if the pregabalin gabapentin fails. And sorry, Dr. Ramesh, we were not able to hear you.
Gabapentin or amitriptyline for the neuropathic pain.
Yeah, that's what we are discussing. That if gabapentin or pregabalin doesn't help, then you can put the patient on amitriptyline. Okay. So the history of the chickenpox, because I was giving away the diagnosis when I said that pain is on the right side of my chest. If I had said the pain is on the left side, it would have made things more complicated. So, but again, as Dr. Rami said, you need to ask about trauma, history of a fall, things like that, the mechanical aspect of the injury as well. So apart from that, just 2 or 3 more questions, important questions. No, I won't say that, but yeah, it was definitely a good consultation because your IPS, it's always going to save you. So I don't think so that you need to input that image. So, Dr. Ramesh, what do you say?
Yes, thank you so much, Ala. It was a good consultation. Your IPS is good, but please.
Dr. Ramesh, we cannot hear you. Can you please repeat? Ramesh, can you repeat? Because I think your internet is little.
I don't know. Like, so, I couldn't hear Dr. Savan. Sorry. So I'm saying that your IPS is always great, but I would suggest you to change a bit of the tone when you are talking about like some highs and lows, when you are talking about some pain. Oh, and in shingles, this is due to a nerve pain. Nerve pain is really very severe pain. It's a very severe kind of pain in shingles. My grandfather had it, so I know about it. So it's very severe pain. So you have to ask and you have to do a lot of empathy in this station. When you talk about in any pain station, just do some empathy, just don't rush, just do talk about empathy, just show your IPS there and there when the patient tells you about the presenting complaint. Because I feel that you guys, when you are told about like it, so you guys rush towards the like OT para or Socrates and then the differentials. Just show some IPS when you are told about the presenting complaint by the patient. Otherwise it was a good consultation. Yes, I agree. Other than that, obviously you have to advise the patient regarding something. I totally agree with Saban when he said you about the 3-day thing. You only give antivirals, acyclovir, when the patient presents within 3 days. Otherwise you go for the neuropathic painkiller and the painkiller. And doing the symptomatic treatment first here is really very important. Then you have to talk about the like advices that you have to wear loose fitting clothes, you have to keep the area clean, you can use some cool compresses or some cold water towel or some ice inside the towel. Other than that, you can use some antibiotic cream as well on the. No, we don't use any antibiotic cream here. Yes.
No, the topical there's like what they call the gel that is.
Yeah.
Yeah, and
Yes,
the
we
patch is.
that antibiotic cream. It came out of me.
Bye, Dr. Nisha. Bye.
I see.
Sorry, Abdullah, are you trying to ask some questions? Okay. So let's move on to the next consultation. I think what topic are we going to do now? It is CVS or we're going to move towards respiratory, Dr. Ramesh?
We can do 2 or 3 scenarios from respiratory as well.
Okay, and okay, fine. Then I think Dr. Imran, he will do the first one from respiratory, and then you will do one from the respiratory. Okay. Okay, fine. But that will be at the end. Yeah. You can. So, Dr. Ramesh, you can give one scenario to Dr. Imran from respiratory.
Yes, sure. Hello, how are you?
I'm good. Thank you. How are you?
I'm good as well. So, okay. So you would be an FY2 in the GP surgery, Mr. Adam Smith, 55 years old, comes to you in the hospital with some concerns. Take a history and discuss management.
Okay.
Okay, so I'm in GP or in hospital?
GP.
GP.
So this is a follow-up, right?
No, it's not a follow-up. It's like the first presentation. The patient has come with some concerns. You have to talk to the patient and concerns.
Hospital, I was saying.
No, the GP surgery.
Okay, no problem. Yeah.
Okay. So tell me when you're ready on the timer.
Yeah, I'm ready.
Begin. Enter the room.
Hello.
Hello.
My name is Dr. Imran. I am one of the doctor working in this GP surgery. Can you just confirm your name?
Well, yes, doctor. My name is John Smith and I'm 55 years old.
Okay, great. And what can I call you for the purpose of consultation?
John is fine, doctor.
John, nice to see you.
Thank you so much, doctor.
John, how can I help you today?
So, doctor, I'm having this cough and I'm really worried about it. It's been going on since the past 2 months, and it's really worrisome for me.
Oh, I'm really sorry to hear that you mentioned it's really bothering you. And it's been for the last 2 months. You feel now it is getting more worse?
Well, yes, doctor. In the start, I had the cough like off and on, like 1 or 2 days later. But now I'm
Oh,
having
that is.
all day, almost all day, really bothering me.
Okay. And do you have anything else with the cough, like any sputum?
Okay, so no, it's not having
Dr.
any.
Ramesh, we are not able to hear you. I
It's
think there's
dry.
something wrong.
Just a second. So it's some dry cough, doctor.
Move on to the next station.
I will start.
You-
No,
Can
we'll
you hear?
start for once Dr. Ramesh rejoined us. I don't know what case she has given to you.
Might be
Hello,
tuberculosis
hello,
or cancer.
Yeah, now we can hear you.
Okay, great. So,
So
yes,
I
you
think
can
we need to
start.
start.
So, do you have any other? Yeah.
I will start from the beginning, okay?
Begin. Enter the room.
Hello, my name is Dr. Imran. I'm one of the doctor working in the GP surgery. Can you just confirm your name?
Well, yes, doctor, my name is John Smith. I'm 55 years old.
And what can I call you for the purpose of consultation?
John is fine, doctor.
John, nice to see you.
Yes, doctor, thank you.
How can I help you today?
So, doctor, I'm really very worried about my cough. I'm having this cough since the past 2 months. It's getting worse, doctor. Please do something for it.
I'm really sorry to hear about that, and you're really worried about that. I am here to help you out. Just to have better understanding about your condition, I'll be asking a few more questions. Please bear with me. All right.
Okay, doctor.
And you mentioned you have been having this cough for the last 2 months. Do you feel now it is getting worse?
Well, yes, doctor, it's getting worse since the last 2 months. I had this cough off and on in the start, but now I'm having it all day.
All right. And anything that makes it worse?
So getting worse. Well, no, I guess it's there.
Okay, I see. And anything that makes it better?
No, doctor, nothing is making this better.
And anything else other than this cough? Any sputum, phlegm?
No, doctor, there is no sputum, there is no phlegm. It's a kind of dry cough.
All right, I see. And do you have any recent fever?
Yes, I had fever a week ago.
A week ago. And how are you feeling now?
I feel fine. I don't have fever at the moment.
Good to know that. And have you noticed any blood in your sputum or anything, something like that?
No, doctor, I haven't noticed any blood.
Okay, I see. And do you feel any shortness of breath?
Yes, doctor, I do feel that I am having some breathing difficulty as well.
And since when you are having this problem?
It's like since 1 week.
Okay, and you had cough problem for the 2 months and you are having this shortness breath for 2 weeks, right? And do you
Yes, a
feel
week.
any chest pain?
No, doctor.
Okay, and do you feel any heart racing?
No, doctor.
Any recent change in your weight?
Well, yes, I feel that I'm losing a bit of weight.
Okay, and do you have any idea how much weight have you lost?
Maybe 1 or 2 kgs, because I feel that my clothes they are a bit loose now.
Oh, I see, I see. And was it intentional or you have no
No,
idea of the weight
it
loss?
isn't.
Okay, I see. Any lumps and bumps in your body?
No, doctor, no lumps and bumps.
Any night sweats?
No, doctor.
Any change in your appetite recently?
No, doctor. I eat less from the start.
Okay, I see. Have you traveled abroad recently?
Well, yes, I went to South America, and it was like 2 weeks
All
ago.
right. Okay, and how was your trip over there?
Well, it was good. I went to meet my son. Everything was good.
Okay, and did you spend a quality of time there?
Well, yes, I wanted to, but my son, he also had this similar cough.
All right, I
So
see.
I
Since when he
spent.
is having this cough? You mentioned your son is having this problem.
I didn't ask him because I didn't ask him. He says that it's off and on. So yes,
Okay, I
maybe
see. And
the
is
weather.
he with you at the moment?
No, doctor. I am
Is
back in
he,
the
I mean,
UK.
is he living with you also?
No, doctor.
Okay, I see. And thank you so much for answering all my questions. Do you have any long-term health problem?
No, doctor.
Any regular medications?
No, doctor.
I see. And any allergies?
No, doctor.
Any family history of any lung problem or any chest problem?
No, doctor.
Just quickly asking a few questions regarding your social life. Do you smoke?
Smoking. Yes, doctor. I do smoke. I smoke from since the past 25 years. I smoke 20 cigarettes a day.
Okay, I see. And have you ever thought to quit smoking?
No, doctor. I really can't. I've tried, but I can't.
Okay, I really appreciate it. At least you have tried. Okay, we will also talk about this. And do you drink alcohol?
No, doctor.
And can you tell me what do you do for your living?
Well, doctor, I work in a wood industry, and thank you for asking that. I just remembered that one of my colleagues, he's been diagnosed with asbestosis, and I'm really worried because he had the similar cough, and now I'm
Okay,
also having.
see. And how is he doing?
Oh well, he just got diagnosed a week ago, so he is just
Okay, I
on his,
see.
and he's getting tested.
Uh, and you mentioned you have been having this problem for the last 2 months. How are you coping with this?
Oh, doctor, it's really bad. I've been taking off from work as well.
Okay, I see. And do you have any idea what could be the cause of your symptoms?
I'm thinking that it's going to be the same thing like my friend.
Okay, no problem. Bear with me. Just quickly examine you, check your
Mm-hmm.
observations, your saturation level, and also listen to your lungs and chest. All right. And I will also look for the lymph node in your armpit and in your neck area.
Okay.
Thank you so much for bearing with me and answering all my questions. From what you have told me, and after examining you, I'm suspecting you are having something serious. I'm really worried about because you are having this cough for the last 2 months, and you
Mm-hmm.
also in a wood industry. I'm
Okay.
really worried. Might be it can be something serious like mesothelioma.
Okay. All right. And what is it?
Yeah, it can be something quite serious. So just to make sure, I'm worried it can be a cancer, lung cancer.
Okay. All
So,
right.
but I'm just suspecting that just to confirm, we have to refer you urgently within 2 weeks to the specialist, and
Oh,
they will be doing further investigations, might be including X-ray and doing camera test, might take a tissue sample from there, and then when
mhm.
it according needed, we can go for CT scan also.
Okay. All right. So you are saying that I'm having this cancer, doctor. I, is it like something serious? Am I going to
I'm
die?
really sorry. I'm really sorry.
Move on to the next
It
station.
might be something very quite serious.
Okay.
Thank you
Thank
so much.
you. Welcome. So how do you feel about the station?
I don't know, time management was poor, and you were trying to be a difficult patient. You are
Okay.
not listening yet. Yeah.
So basically, some stations there are a lot of history to be taken. I would suggest you to history in those stations like, okay, John, I just want to ask you a few yes/no questions. Would that be okay for you? So that you can ask the questions quickly, and the patient can ask you just in a one word. So that would be good for you as well. Other than that, I don't know. I try to be calm, and traveling and cuffing son were distraction. I don't know. It's written in the the calibration that he traveled to like Tanzania, and his son had similar cuff. So I was just reading the calibration. I didn't make up on everything on my own. So yes. Other
No,
than
that
that,
Tanzania, yeah, that's in Africa, but you mentioned South America.
so what? I just changed the country.
You know, I was thinking between infection and then you go to the wooden work.
Yeah.
So you keep me
Okay.
between two
So,
things, and you did not give me a proper history for cancer. No
so
sputum, no
yes.
like blood.
Okay, I
Still
mentioned
somehow with weight loss.
Okay, I agree. I mentioned about asbestosis. Why would I mention when I'm saying that, doctor, I feel that I'm having the similar condition as my friend. I work in a wood industry. So obviously I had like the scenario of lung cancer, in which the patient had said, he was saying that, doctor, I am a plumber. So yes, you can get any kind of occupation. So you have
But
to
what was
diagnose.
this like? Was it a cancer or TB? What was that?
So basically, yes, it's cancer. You are going to say that I'm a bit concerned about it. This could be anything. In the best case scenario, it can be a long infection that you are having, and you are due to that infection you are having cough. But as you mentioned that your friend has been diagnosed with similar condition, who is working with you. Also, you are working in this wood industry that causes a lot of lung problems, and you have weight loss as well. So I'm suspecting that you might be having something serious, which we call as asbestosis, like your friend, or mesothelioma. So
Yeah,
yes.
I think it was a good station. Only thing was the sun that totally distracted, like, and
Well,
other
I
things,
don't know
like
why they mentioned. Maybe due to some distraction, they mentioned the sun about it, but otherwise, obviously, the history was clear. Like in the wood industry,
yeah, I do
and
understand. Yeah, this was the only thing. Yeah, might be.
the
But
weight loss, and
how was the
obviously,
call? I mean,
yes, any unexplained cough or any unexplained weight loss or any symptom that is more than 2 months. So you go for and you have weight loss as well. So you go for the diagnosis of cancer.
yeah.
So yes, this is it. But just go for the best and worst case scenario when you are talking about cancer, because this is obviously something big for the.
Yeah, I know. I was trying to say this sentence, but I was really worried bell is gonna ring any time. I want to rush it, you know.
So you can maybe rush in the history part when you are talking about all right, so you told me, because I felt that in the history part you were a bit confused what questions to ask. So you have to ask that in a flow. You need to know about what you have to ask in the history of a respiratory station. All right, you said that you are having cough. Since how long have you been having this? How did it start? Do you feel any breathing difficulty along with cough? And is it getting worse or better? No, doctor, it's getting worse. All right. By any chance, do you have any sputum or phlegm in it? No, doctor. Any blood? No, doctor. All right. Apart from the cough, by any chance, do you have any fever? No, doctor. All right. Any leg pain? Any leg swelling? Any night sweats? Any weight loss? So these are the things which you can ask, but you have to obviously ask in a quick way, not so quick, but you have to ask these questions. But when you are ruling out the differentials and you see that your time is running and you have a lot of stuff to ask, just go for okay, John, just a few years yes no questions so that we can get to the point quickly. Or okay, John, I'm just going to ask you a few questions. Maybe these are just few yes no questions. Would that be okay for you? Okay, so you can go with the questions. That would be quick. But it was a good
Yeah.
attempt. You are preparing at the academy, so you'll get fine. Otherwise, I would suggest you to, when you are talking about the station, so you say that, hello, For example, if I'm introducing myself, I'll say, hello, hi, doctor. So I'm Dr. Khan. I'm one of the doctors in the GP today. Could you please confirm your full name and age for me? Yes, doctor. My name is John Smith. I'm 55. Okay, nice to see you, John. Would that be okay if I call you John today? Yes, John is fine. Okay, so John, I can see from my notes that you have some concerns. Can you tell me a bit more about it? Yes, doctor. So I'm having this cough. So this is going to be like you have to like change a bit of your grips, I would suggest.
Yeah.
Okay, all right.
Thanks.
No problem. Thank you so much for performing. Saban, do you want to say
Yeah.
anything?
So,
Also, we have to ask about drug abuse as well in this station.
So, Dr. Imran, yeah, it was a good attempt. I have one question for you. What was the age of the patient?
55?
Did you ask?
Yeah, you told me
Okay.
in a single go.
Okay. So the thing is that you do need to stop after asking a question like you did signpost when you were going to ask about social history. Said I'm going to ask you some questions regarding social history. Do you smoke? No. I'm going to ask you some questions regarding social history. Is that okay? Take a pause and ask the next question. So other than that, yeah, it's a good attempt. And yes, you got confused between TB and mesothelioma. So otherwise, you would have finished it in the time as well. So, but just a variation in the tone, and you're good to go.
Yeah.
Just that case, okay? And just take pause after asking every question. It isn't that we are rushing towards the.
It's taking too much pauses.
Okay.
Yeah.
So
Why
other
were
than
you
that,
concerned about TB? TB would be having fever. TB would be having night sweats. TB would.
because you
No. I was only thinking at the when you said sun. No, I never thought about
yeah, because you give the history of sun and also traveling to South America.
traveling. No problem, but sun. When
Yeah.
you said sun, I said, okay, might be.
So the both Tanzania and South America, those areas of the world, they are more prone to risk. They have high risk of TB. So that's why consultation, let us there. And moreover, the sun is also having similar symptoms. It was a huge distraction.
Okay, so let's do another scenario from the online students. I went for TB also. I don't know, guys. Just on the basis of traveling, you guys are saying that it can be TB, but TB would be having symptoms that are very different from these. So, yes. So we would do one with the like online doctors. Asia, can you hear me? Are you ready to do a scenario?
Yes, hello, Dr. Ramesh. How are you?
Hi.
Yes, thank you. I would love to do this scenario.
Okay, great. Okay. So you would be an FI2 in the medicine department, and John Smith, a 30-year-old, comes with breathing difficulty. You have to take a focused history and perform relevant examination and address his concerns.
Okay. How long? How old is he? I'm sorry.
30 years old.
30. Thank you.
It's okay.
Yeah. Perfect. Should I say turn on the? Yeah, I will do it.
Yes,
Perfect.
you can yourself if you want to.
Begin.
Yeah, enter the room.
Enter the room.
Anastasia Shubina, 801-5946. Hello there.
Hello.
I'm Dr. Anastasia Shubina, one of the junior doctors here in the department. May I please confirm your name and age for me?
Oh, well, yes, doctor. My name is John Smith, and I'm 30 years old.
Wonderful. Thank you so much. Is it okay if I call you John today?
Yes, yes, doctor. You can call me John.
John, I can see you're in a pain. What happened, John?
Oh no, doctor. I'm having this problem. I'm having this breathing difficulty. Can you do something about it? I cannot breathe, doctor.
I see. I'm really sorry to hear that. Of course, I will do the examination of your oxygen level, I will check your oxygen saturation right now. Is it okay for you?
Oh, okay, yes. So oxygen would be 84.
John, we would definitely give you oxygen right now to help you breathing. Is it okay for you?
Okay, doctor. Okay.
Yeah,
All right.
I'm
So
giving. How do you
it's
feel?
fine.
Wonderful.
Is you
John, tell me please, what happened? How can I help you?
So, doctor, I'm having this cough since the last 3 weeks, and along with this cough, I'm having this breathing difficulty now since the past 1 week.
I see. Is it the first time you go to the hospital with this problem?
Well, yes, it's the first time.
I see. And 3 weeks ago, how did it start?
I don't know, doctor. It started like gradually. It was some gradual thing, and then now it's getting severe, doctor.
Oh, I'm really sorry, John. And do you have any cough?
Yes, doctor. I do have cough with it.
Yes. And could you describe this cough for me, please?
Well, it's coming off and on with the breathing difficulty, and I have this phlegm as well in it.
Okay. And how could you describe this phlegm for me? What is it?
Well, it's like white in color. I had it like an hour ago, and it was like 1 tablespoon.
I see. Thank you for sharing. And have you noticed any blood in it?
No, doctor, no blood.
Okay. Okay. And so 1 teaspoon during the cough. And have you tried any medication for it these 3 weeks?
No, doctor, I really haven't tried anything.
Okay, John, do you feel that anything makes it better? Your breathing?
No, doctor, nothing is making it better.
I see. And do you
Doctor,
think?
I
I'm
can
sorry.
can give me the oxygen, and then I really want to go home. I have to do some stuff at home.
I understand. And may I please wonder what stuff do you have at home?
Well, doctor, I really have important stuff. I cannot talk to you about it, but can you please give me something for the cough and breathing difficulty so I can go home?
I see. I see you're in a hurry. That must be something very important. But would you mind if I ask you a few more questions, and then I will help you and we'll decide what to do to help you the best. Okay?
Okay, all right.
Thank you, Joan. So, do you feel any fever right now?
No, doctor.
No, I see. And besides this cough with phlegm and besides this problem with breathing, do you have any other symptoms?
Other symptoms? No, doctor.
Okay, I just will ask you a few more yes/no questions to make it more quicker. Is it okay? So,
Okay.
have you noticed any weight loss recently?
Well, yes, doctor. I have seen a significant weight loss, doctor.
Okay, and significant, how many kilos, how many stones?
It is like 1 stone.
1 stone.
Like,
How
yes.
for how long? I'm really sorry. Yeah, for how many
Hello, can you hear me?
months? Yeah, I can hear you. For how many months? 1 stone.
So it's been happening since 2 months.
Okay, John. Okay, John. And is there any chance of you traveling somewhere recently?
Oh, no, doctor. I haven't traveled. I don't have this kind of money. I don't work.
Let's see.
So,
You don't work, okay. And where do you live?
doctor, I live at my friend's place. I had a place, but I don't have any place now.
You
I'm
haven't.
basically I live at my friend's home.
I see. Is and why don't you have your own place? Are you out of money or something like this?
Yes, doctor, I don't earn. If I tell you something, please don't tell it to someone. So I take this heroin, and my parents, they don't like it, and they asked me to leave, so I don't have any home.
John, I appreciate your sharing with me this information. I can assure you that this will be besides us, and will be absolutely confident. For how long have you been taking this drug?
Well, so doctor, it's been like maybe 6 years, doctor.
6 years. I see. Thank you. And have you ever heard about needle exchange program?
Oh, well, yes, I heard about it last, but I
Yeah.
really don't know what.
Okay. And have you ever tried to quit taking it?
No, doctor, I really like doing it, and I have my partners, they also like doing it.
Okay. And according to your partners, are you in relationship with someone?
Well, yes, I have multiple partners, not any stable one.
Okay. May I please wonder what is the gender of your partner? Is it a male or female?
Well, yes, they are male.
Okay, thank you for sharing, Joe. So according to your breathlessness, I would like to examine you. I would like to check your chest, examine your chest, do the examination of your lungs, of your heart, do the measure of your temperature, of your oxygen, again, blood pressure, heart rate. I would also love to perform the X-ray and do some blood tests, because I think that you probably may have an infection called pneumatitis pneumonia. Have you ever heard about it?
Oh no, doctor, but I, what treatment are you going to give me? I really want to go home. I want to take my heroin, doctor.
I understand that the treatment is serious because the infection is very serious, and without treatment, you will have more and more symptoms. So you have to do the treatment properly. If you don't mind, we will admit you for further investigations and for giving you some antibiotics, which is very important for this kind of infection. I'm so sorry. This is not antibiotics. It is antimicrobial medication, because this infection is caused by yeast. Yes, and we have to give you the special treatment in the hospital. So you should be admitted.
Admitted? Oh no, doctor, I cannot be admitted. I really need to go home. I have to do my thing. I cannot like stay in the hospital.
Joan, I understand that you want to go home because you want to have another dose of drug you take for so many years. I can help you with this, not by the drug you take, but by the special medications called metformin. And not metformin. Not metformin.
You just take the names of the medications. You just methadone you have to offer.
Sorry, yes, I can offer you the methadone, which will help you with the all the
Flags.
yeah. Again, I did it again. Ah!
It's okay. It's okay. You did it really well. History taking was good. Your IPS was good. You were showing empathy and you were showing your IPS even when I told you about my heroin thing. So I really liked the reaction which you gave. It was good. Other than that, so basically in the respiratory stations, you can go for the X-ray. So there would be some X-ray findings. Otherwise, I don't think in other stations there would be any need of doing the X-ray. But yes, you can talk about X-ray here as well. So in here, you can get some inflammation. So yes, thank you so much. Yes, it was a good station. I really liked it. Just a bit more differentials you can add, like any leg pain or swelling. Did you ask about that? No, you didn't.
No, legs, about legs. Yeah, forgot about the legs. I forgot PE, yes, and but
Any night?
yeah, PE wouldn't be so chronic. I mean, 3 weeks for PE is so. I thought about tuberculosis. I thought about what else? Other pneumonia.
Mm-hmm. Okay.
Yeah.
What else? So basically, lifestyle is important. You have to talk about alcohol, smoking, IV drug.
Yeah.
So these things that fine. Just move on towards the observation. Talk about I'm going to check your observations and your oxygen level again. I hope it's getting fine now. I'm going to do some chest examination. Would that be okay? Also, I would be examining some glands in your body. We don't say lymph nodes. So other than that, I'm also going to prescribe and I'm also going to go for a bedside X-ray as well. So if the X-ray would be there, they will give you findings. If no, just leave it. So you have to talk about diagnosis. Yes, this is a chest infection. So you have to do the symptomatic treatment. You have to give antibiotics because this is a kind of pneumonia. Although it is due to a yeast like Pneumocystis carni.
Trixamazole.
Okay, so yes, you have to give go for time a patient, other patient, and talk about going to go check your, as you told, you are phlegm. So we would be taking some secretions and phlegm, and will be the lab to confirm the bug. Okay for you.
Yeah. Yeah, because I was thinking about how to encourage you staying in a hospital. That was all my thoughts. Like, the patient wants to go home to take drug. I should be very attentive to this, and that's why I forgot everything. Like
It's okay.
HIV testing,
Mm-hmm.
should be also do it, like the
So
examination.
for multiple partners, you can talk about.
Thank you so much. Thank you. I'm really, I feel so nervous when I practice exactly with you, Dr. Ramesh. I don't know why. I just feel that you make me so nervous. But you know.
Okay, I'll else next time to be your patient. Would okay? Yes, you can do that. If Dr. May would have been here, maybe she could have been, but she would be here. She would be regular with us.
No, I like it. For practice, it's the best practice I can imagine, because when the patient doesn't make me nervous, that's easy peasy. So when so I
You
love practicing with
get a
you.
lot of business when you are going for that. It's absolutely normal. It's not just flap to any kind of exam. You have anxiety and nervousness, so don't worry. You are doing. I your history taking is good. Just you have to do a bit of and can get better when you are practicing.
Yeah. Thank you so much.
Welcome. Thank you so much for performing. So, Saman, are you there? We want Dr. Insha, and if Dr. Imran wants to perform again. Hello.
Yes, hello. I'm Dr. Insha.
Hi. How are you?
I'm fine. How are you?
I'm good as well. So, what would you like to do? Would you like to go for respiratory, or would you like to go for chest pain scenarios?
Both are fine, either way, it's fine.
Okay, all right. Just let the calibration. So, okay. So you would be an FY2 in the GP surgery. John Smith, a 40-year-old, will come with some concerns. You have to talk to the patient and discuss management with the patient.
Okay.
Do you want to keep your own timer?
Yeah, I'm just starting the time.
That's great.
Again. Enter the room.
Hello, I'm Dr. Alina. Could you please introduce yourself?
Well, yes, doctor. I'm John Smith. I'm 40 years old.
Hi, John. How are you doing?
Doctor, I'm doing good, but I'm having this cough, which is really worrying me.
Oh, I'm so sorry about that. Can you please elaborate a little bit?
So doctor, this cough, it started like 5 weeks. Now it's 5 weeks now, and it's getting worse, doctor.
5 weeks, that is a very long time. You must be very distressed.
Well, yes.
Can you describe your cough a little bit? Is there any production in it? Do you feel like there is any cough in there? Sputum.
Yes, there is the sputum. It's there, and it's like, I think, green in color.
Oh, okay. Can you please tell me if there is any blood in the sputum?
Uh, yes, doctor, I noticed blood twice in the sputum.
Okay. When did you notice the blood?
It was like a week ago. That was alarming for me. That's why I booked the appointment with the GP urgently.
Oh, yes, you must be very worried then. Can you please tell me if you have any other symptoms other than the cough?
No, doctor. It's just the cough. And
Have
I
you had
had
any chest pain?
2 days back.
You had fever when?
2 days back.
Okay, all right. And can you tell me if the fever was constant, or was there, did it come in?
So the at night it was
Dr. Ramesh, I can't hear you actually. You're
doctor, please mute Dr. Yasir. A
yes.
lot of homicide. Yes, that's great. Okay. So yes, doctor, I had this cough 2 days back. Sorry, I had fever 2 days back as well.
Okay, can you tell me how much your temperature was? Have you checked?
Yes, it was 101. I checked it.
Okay, all right. And can you tell me a little bit about your okay, so have you had any shortness of breath?
Yes, doctor, I felt that I had it a week ago, but now it's fine.
All right. And have you had any chest pain?
No, doctor.
Okay. Have you felt like recently you've lost a lot of weight?
Yes, doctor, I have lost like 2 kgs.
Okay. And how about your appetite?
My appetite is fine.
Have you had any, have you seen any lumps and bumps over your body?
No, doctor.
Have you felt any night sweats?
Yes, doctor. I don't know why I'm having these night sweats, and it's been happening since 5 weeks now. It came with the cough. I don't know. I never had night sweats in my life.
Oh, I understand. That must be very distressing for you. I get it. So can you tell me a little bit more about, is it okay if I ask a little bit more about your lifestyle habits?
Okay, all right, doctor.
What kind of diet do you eat?
So I eat healthy. I sometimes eat outside, but mostly I eat at home.
Do you exercise regularly?
No, doctor, I don't.
Do you smoke?
No, doctor, I don't smoke.
All right. And do you drink alcohol?
Yes, on weekends.
Okay. A little bit about your general health. Can you tell me a little bit about your, have you had any medical conditions in in the past?
No, doctor, I don't have any medical condition.
Okay. And are you on any regular medications for anything?
No, doctor.
All right. And how about your family? Have you seen any medical conditions in your family?
In my family, well, my grandfather had this similar cough, and I don't know, he wasn't diagnosed with anything.
All right. Okay. So can you, okay, sorry. Have you traveled anywhere recently?
Well, yes, doctor, I traveled to Africa.
Oh, when was that?
It was like 1 month ago.
All right. And has this cough affected your life in any way?
Well, yes, doctor, it's this cough, it's getting severe. So I've been taking off from the university since the past three, no, from work since the past 3 days.
Oh, I'm so sorry about that. Have you tried anything to relieve your cough?
No, doctor, I tried some soothing medications and some lozenges, but no, doctor.
Okay. This may be a little bit uncomfortable to ask, but this is a protocol question. Can you tell me if you've used any recreational drugs?
No, doctor, I don't.
Okay. So can you all right. Would you mind if I examine you for a little bit?
Okay, yes, doctor, thank you.
Okay, so I'm just going to check your observations. I'm going to listen to your chest, and I'm going to tap and feel your chest, and I'm going to check your legs and your tummy. Is that all right?
Okay, all right.
Okay, thank you. So do you have any expectations from our consultation today?
Well, doctor, please tell me why I'm having this cough and this phlegm.
Yes, I understand. And we'll get to that in a minute. Do you have any ideas what could be wrong with you?
No, doctor.
All right. So from what you have told me and from the examination I've done, it looks like you could be having an infection, a bug called tuberculosis. Have you ever heard of it?
No, doctor. What is it?
Tuberculosis. It is a bacterial infection of your chest. In your lungs, there sometimes can be a bug that can cause some infection, and it can cause something called a pneumonia. Have you ever heard of that?
Well, yes, I have heard about pneumonia.
Yes, so tuberculosis can cause that. So which can cause the symptoms that you have had. And what we're going to do for that is we're going to first we're going to I'm going to offer you a few medications. These are antibiotic medications. There is a specific set of medications that we give. There are 5 antibiotics that we give for tuberculosis and 4 antibiotics that we give for tuberculosis, which you have to carry on taking for 4 months. And you're going to have to be very regular with the medications, and we're going to have to find out whatever if you have had any contacts with other people, because this is a contagious infection. You can transfer it to other people. Are you following me so far?
Okay, all right, doctor.
All right. And for your cough, I'm going to offer some cough medicine so that it can soothe your cough, and it can decrease the sputum that you're producing.
Okay, all right.
Over the time up.
Thank.
Actually.
Okay, thank you.
I'm not sure if I diagnosed it correctly.
So, okay, it was TB, but the diagnosis that you were saying, like the explanation, it wasn't good enough, and it was not like, I felt that you were a bit haphazard in that. So no worries, we can discuss that. So, yes, it was TB because it had cough, it had fever, it had sputum, it had travel as well, weight loss as well. So these are the things which you can see in TB. So you did the grips part, okay, it was good. And then moving on towards the cuff, it was fine. Then we talk about the differentials. You talk about the differentials, it was fine. Everything was asked. Yes. Like when you asked about the IV drug abuse, so you said that this is just a protocol question. So basically, in UK or anywhere else, usually people do use drugs. So you can just say, I just need to ask a few questions about your journal health and your lifestyle. Would that be okay? So you ask about lifestyle, you ask about journal health. In lifestyle, you are going to say, okay, don't want to alarm you, but by any chance, do you use IV drugs, okay, so you told me that you don't smoke. By any chance, do you use any kind of recreational drugs? You can just say this because asking about drugs is like not a big deal.
Okay.
Okay. So, regarding smoking, you have to ask smoking. If the patient is smoking, then you have to ask about smoking in a bit detail, like how many
Yes.
cigarettes, how long have you to cut it down, because it is one of the risk factor. Other than that, traveling to South Africa is also a risk factor. So you have to tell these things in your provisional diagnosis. Also, you can mention about in the respiratory stations, you can mention about the X-ray as well. You would be getting fine.
Management part, I forgot a little bit for a second.
So yes, I felt that you were like a bit confused in that. So you told me that you are having this cough, and it's there's phlegm as well, and it's green in color, along with some weight loss and night sweats. So I'm a bit concerned about you, and I'm suspecting that you might be having an infection, what we call as tuberculosis. Have you ever heard about it? No, doctor. All right. Well, it is due to, this is an infection, and it's due to a bug, and this is usually a slow growing bug. It keeps in your stays in your body, and it slowly grows, and your lungs are involved in that, and it's quite difficult to treat. So sorry to tell you, but it's quite difficult to treat, and the treatment is very long as well. Most probably your stay in the South Africa would have caused it. And also you told me your grandfather had similar cough, so it can be one of the reasons as well.
Okay.
Okay, so because it's spread through respiratory droplets, it might transmitted in the childhood as well from the grandfather, and had stayed in the body and slowly grow. Yes, have had grown. So for now, John, I don't see that you have your observations are fine. So we are just going to start you on some routine investigations, and we are going to check your inflammatory markers as well. We are going to check your phlegm as well, and we are going to send it for culture. Would that be okay for you, so that we can confirm about the bug? Also, John, this is a notifiable disease, so we have to inform the local authorities as well, and you you would have to inform everyone, whoever you are staying with or you are working with, because this can be transmitted through your respiratory droplets. Would that be okay for you?
Yes.
Also, you have to refer to the multidisciplinary TB team here in this thing. And if needed, then they are going to admit you and isolate you as well. How do you feel about it, John? So regarding the antibiotics, John, so basically the treatment of this tuberculosis is a bit extensive. We have a set of 5 antibiotics, and there are a few side effects of these antibiotics as well. But you have to take these antibiotics for a longer duration. First, we are going to start you with 2 antibiotics, and we are going to see the results. If the results are going on fine, and if everything is going on fine, then we are also going to add other drugs. We are going to keep you monitored so that you don't have any kind of side effects, because obviously they have peripheral neuropathy, they have liver failure as well, they have like rifampicin, it has red urine as well. Also, I would like to tell you that if you feel that you are having any kind of red secretions or red urine, so don't be alarmed. This would be just due to one of the medications of tuberculosis. So you might have to take them for a few months so that the infection is completely eradicated from your body. I see that this must be difficult for you to take this all in, but I'm going to give you some reading material, and maybe you can come back if you have any questions in mind. So yes, this is it. Do you have any questions in mind?
Me, no.
Okay. Did you do the mock today? How was it?
No, I didn't do the mock today.
Okay.
There was no mock today actually. We just
Okay.
had it in the morning. Yeah, we have it next week.
Okay, all right. So Dr. Imran is here with us. Do you want to go for another scenario, Dr. Imran?
Yeah,
And Insha, stay here. You are going to be the patient.
Okay.
Also, I would suggest you, whenever you are practicing, if you don't want to perform, if you don't know about the scenario and about the like how to perform it, just be the patient. Because when you are the patient, you get to know about a lot of things, because you are actively listening to the person who is performing, and you take out mistakes.
Yeah.
So I am going to give you a scenario. You did a chest pain scenario previously, or no? It was mesothelioma. Let's go for
Dr. Ramesh, just a quick question regarding the tuberculosis case. Do we need to
yeah.
explore the sexual history as well?
Well, yes, because the patient might have multiple partners, or patient might be IV drug abuser. So yes, you have to talk about sexual history, but that totally depends on the time. If your 2 minutes
Yeah,
bell
because
has
this scenario is really so lengthy. Management is so big and the
well,
history taking is so
ev-
vast.
every scenario is lengthy. Few of the scenarios are there which are a bit shorter, but obviously you have to keep focus differentials in your mind. What you need to ask in that scenario, you cannot ask all the differentials. For example, in headache scenarios, you can not ask all the differentials. You have to keep focused and ask about focus differentials. So keep that in mind.
And about the patient, we need to ask about like who does he live with, and because most of the patients of tuberculosis
Yes,
they may be homeless or drug abusers. So that
Yeah.
part we need to explore as well. So all the three major things. So it would take bit of a time.
So yes, you have to, as I told Insha, that she has to tell everyone who has been in contact and who are living with them or at their workplace, because this is really important, because this is a transmitted disease. This is an infectious disease. You have to notify the health authorities and the people who are there. So
Yeah.
asking about living with you is an important question as well.
Yeah. Okay.
So
Yeah. Thank you.
in the history part, you can just explore about the cuff. I believe if the diagnosis is in the differentials and the history part, it's not in the meftosa part. Few diagnoses are in the meftosa part, or in
Mhm.
the life. There are few scenarios in which the diagnosis lies there in the journal health or lifestyle. But if you have the diagnosis previously, so you diagnose the station in the Socrates. Like for
Mhm.
example, you can diagnose it. Chest pain scenarios, you can diagnose it. Even these scenarios, for difficulty, it has fever, it has weight loss, it has night sweats. This is TB.
Mhm. Okay. Yeah. So
Asking
we
about
don't have to
travel,
go on the pneumocystis carinii thing.
sorry.
We don't have to go for the pneumocystis carinii pneumonia thing.
No.
Okay. Just because the patient had night sweats, we are looking for tuberculosis. But if
Mm,
night sweats was not there, so it could
hmm.
be.
Well, the sputum color also, the sputum color is green, which is specific
Mhm.
for TB.
Okay. Mhm.
Yes.
Okay. Okay. Thank you.
Welcome. Okay, let's give you one scenario.
Dr. Ramesh, can you see us?
Yes, I can.
Okay. We can't see ourselves.
Why?
Okay, we can continue. We don't know.
Okay, it's fine. I can see you. I can see you both. We all can see you. So you would be an FY2 in the emergency department. A 50-year-old man, Adam Smith, presents with chest pain. ECG has been done and it shows ST elevation. You have to take a focused history. You have to do the examination and you have to discuss the management with the patient. So it's ST elevation and the patient has chest pain. So it's MI. So Insha,
Yeah.
I would like you to be the patient. Do you know the calibration?
Kind of, yes. To a
Okay.
certain extent.
Don't know about it, then I can tell you about the calibration. So there would be chest pain, it would be central, it would be crushing, it would be like acute kind of pain. So you have to give him an acute timing, like since the morning. And the pain would be severe. You have to give a pain score. It would be radiating and no aggravating relieving factors. So there would be a risk factor as well. It can be smoking, it can be hypertension. It's up to you. Whatever you give, alcohol can be there. So there would be a family history of stroke or something like this as well. So these are the things which you can ask,
Okay.
which you have to tell, sorry. So yes,
Yeah, just we are putting the timer.
Dr. Insha can do that. She has it.
Begin. Enter the room.
Hello,
Hi.
my name is Dr. Khan. I'm one of the doctor working in this emergency department. Can you just confirm your name and age for me, please?
Yes, doctor. I am Adam Smith. I'm 50 years old.
What can I call you for the purpose of consultation?
Call me Adam, sir.
Adam. How can I help you?
Doctor, I have this chest pain. It's very bad, doctor. Help me, please.
Since when you are having this pain?
Since morning, 3 hours ago, maybe it started.
And can you just score your pain for me? 1 being low, 10 being high?
It's at least 8.
Oh, I'm really sorry. It must
Yeah.
be a very severe pain
It
for
is
you.
very
Are you comfortable to talk now?
Please give me some pain.
Okay, no problem. Examiner, I want to give medication, painkiller to the patient.
Okay.
So, and you mentioned it since morning, and was it sudden or gradual?
It started suddenly, doctor.
Okay, I see. And anything that makes it worse?
When I was coming here,
Okay.
I was walking from my home, it became worse.
Okay, anything that makes it better?
No, there is nothing that made it better.
Okay, and does this pain move anywhere in your body?
Yes, it goes up to my jaw when I'm eating, it hurts
see.
even more, and
Okay.
my shoulder as well.
All right. Can you just describe the pain? What type of pain is this? Sharp, dull, crushing?
It's a crushing pain. It feels like something is very heavy is on my
And
chest.
where exactly in your chest?
It's over here on my left side, going up and here.
Okay. Anything else? Like, do you feel sickness?
I felt a little bit of nausea, but nothing else.
Okay. And did you vomit it?
No, I did not know.
Do you feel any shortness of breath?
Yes.
Okay.
feel
And
shortness.
do you feel your heart was racing?
When I was coming here at that time, now I'm not feeling that.
Okay. Has this happened before or this was the first time?
This is the first time.
Okay. You never had this before, right?
No.
Okay. All right. Any recent change in your weight?
No, doctor.
Okay. I see. And do you have any fever recently?
No.
Any cough?
No.
Okay. And any leg swelling or
No, no.
have you traveled abroad recently? I
No,
mean,
I
have you
haven't.
traveled recently?
Traveling.
Okay, I see. And just asking few questions regarding your general health,
Yes,
like do you have any long-term health problem?
I have hypertension. I've had it for 10 years.
Okay.
Yes.
Are you taking any medication for that?
Yes, I'm taking amlodipine for 5 years.
I see. And are you regular follow-up with your
Yes,
GP?
yes. Every 6 months I go and see my GP.
Are you taking any other regular medications
No,
other
no.
than this? Any allergies are you having?
No.
Any family history of any heart problem?
No, last doctor, my elder brother, he died when he was 40, and I think he had a heart attack. I'm not
I'm
sure.
really sorry to hear about that.
Yes, and
Yeah,
my
please accept my condolence.
thank you, doctor. And my
Yeah.
father also, he died of a stroke last year.
Oh, I'm really sorry.
Yes.
How is he doing? Oh, I'm sorry that. So just a few questions regarding your social life.
Okay.
Is that all right?
Yes.
Do you smoke?
Yes, doctor, I smoke.
Okay. What do you smoke?
I smoke cigarettes.
How long?
Since 20 years.
And how many cigarettes do you smoke?
I smoke around 20 cigarettes a day.
Okay, all right. Do you drink alcohol?
Yes, I drink alcohol. Not much. We can sometimes 2 to
Okay,
3.
all right. By any chance, any other drugs do you use?
No, I don't use it.
Okay. Are you physically active? Like, do you go for exercise?
No, I like to sit around and watch TV.
And how is your diet? Like,
I eat a balanced diet.
good. Good to know that. And who do you live with?
I live with my wife and my son.
Okay. How is everything at home?
Everything is fine at home.
What do you do for your living?
I'm an accountant. I sit and work on my.
Any stress in your life, in your work?
No stress in my life.
Okay, I see. And do you have any idea what could be the cause of your problems, your symptoms?
Doctor, I think I'm having a heart attack. It hurts so much, my chest.
Just please bear with me. I will be quickly just examining you.
Yeah.
I will also like to record your observations, like your blood pressure,
Okay.
your heart rate.
Yeah.
And I will also like to listen to your heart. And I would also like to examine your lower legs also.
Okay.
Thank you so much. And from what you have told me, and after examining you, I also got your ECG. I'm really worried. As you mentioned, you are having family history and you have been smoking. Your ECG shows something very serious that is called the heart attack.
I'm having.
I'm really sorry about that. Yeah, so we are gonna keep you admitted in the emergency department. Is that all right?
I have to get admitted.
Yeah, we have to keep you here because this is life-threatening.
Okay.
So we have to admit you. We'll be observing you, and I will be running some other initial investigations.
What investigations will you
Like
do?
full blood count.
Okay.
And just to check your kidneys and your liver is functioning properly. Just to be on sure safer side, I will run for some infection markers and some inflammatory marker. As I'm worried for heart attack, I will also be running for the heart markers, that is troponin.
Okay, doctor.
Just to be on a safer side, I will also go for chest X-ray.
Okay.
So I will also be discussing this with my seniors, and we might have to involve the other specialist cardiologist. They will also come.
What are
and
they going to do, doctor?
yeah, they will come and reassess you, re-examine you, and if needed, they can go for further investigations. Like they can go for echocardiogram also. That is also like ultrasound scan of the heart.
Okay.
Yeah. So right now I'm going to give you some medications to help you out.
Will you
Like
give me
I'm giving
something
some
for pain
painkiller. Yeah,
coming
I'm
back?
just going to give you morphine. That
Okay.
will definitely help you out. And I will also be giving you oxygen.
Okay.
Still other painkiller like nitrates will also help to ease your pain. I will also be giving you nitrates. And I will also give you to, I'm worried your blood vessels in the heart are blocked. So I'll be giving you the aspirin 300 milligram.
Why aspirin?
Aspirin.
I got it for pain.
It is also used for pain relief, but we can also use as a blood thinner,
Okay.
So, so I will be starting all the medications.
Doctor, will I be okay? Will I live?
I'm sure you'll be fine. You mentioned you have been smoking. We'll discuss this when you'll be going back to home. Yeah, we will need some modifications in your life.
Yes, I have tried to stop smoking, but
I
it is
really
very
appreciate that. But when you'll be fine, we have to refer you to the cardiac rehabilitation center also, where you can have, more detail about this.
Okay.
Anything else I can do for you?
Just, it's fine. I just want to go back home once I'm okay.
Yeah, we'll just be observing you here. When you'll be safe to go back home, then we'll send you, but still we'll keep you here.
Okay, doctor.
Maybe for some days.
Thank you.
Yeah. I'm around here, and here's the bell. If you need any help, you can just ring the bell.
Okay. Okay, doctor.
Anything else I can help you with?
No, thank you.
And when you'll be fine, you will discharge, we will refer back you to your team. And from there, they will refer you to the
Move on to the next station.
heart specialist. Thank you so much. There.
Okay, I cannot open my video as well because it's not opening. The host has disabled it. So basically, it was a good attempt. I
That's
like
what I
it.
was saying. Sorry, yeah.
It's
Because
okay.
I was doing that thing.
Yes, so it was a good attempt. It was better than the previous one. And I see that you are really working hard, Dr. Imran. So before coming to that, I would like to ask Dr. Insha, how was she feeling when she was your patient?
Just hey, the questions are good, but as a patient, it's very impersonal to feel. It feels kind of impersonal. That's all. Otherwise, it was pretty good.
Not taking care of the patient.
No, it's not like, oh yes, I understand. Okay, your problem is okay. I will take care of it. It's just more empathy would be nice.
Okay. Yes. So basically, when a patient is telling you about the symptoms, so you have to acknowledge that. You have to say, okay, so you are having this chest pain. That is very worrisome. So can you tell me a bit more
Yeah.
about it?
And also in the beginning, when you asked if you're having pain and I will give you painkillers. So after giving painkillers, you should ask how much is your pain now? Are you comfortable to talk that also? I think.
So yes, after giving the painkillers, you have to say that. Are you
Instead of
feeling
this,
good?
we might say it will take some time. Please bear with me.
Either or.
So anything can be said by the patient, but whenever you give the painkillers, you have to ask again that, okay, so John, how do you feel now? Are you feeling okay after the painkillers? Yes, doctor, I feel fine. Okay, so may I ask you a few more questions? Yes, doctor, you can. So then you go on with your history. You ask about the pain, the Socrates, and then you follow all the scheme. What is the scheme for the MI? So basically, you ask about chest pain. It is the presenting complaint. You then ask about heart racing, any breathing difficulty, any fever. No, doctor. By any chance, did you hurt yourself? No, doctor. All right. So yes, you talk about the radiation and everything else. Then you have to rule out the red flags. What is the red flag in this station?
MI is the red flag in the station mainly, so radiation.
Oh no,
And
so the red flag is basically something which you have to ask in every station. The red flag tells the examiner, when you ask about the red flag, the examiner knows that this person or this doctor is
Mm.
trying to act as a safe doctor. So it's always necessary to act as a safe doctor, ask about red flags. So basically, if a person has MI, so you can think about stroke. So you have to ask about any weakness in any part of the body. That is really very necessary to ask because it can affect your brain. And then obviously there can be a clot. By any chance, do you feel any leg swelling? No, doctor. All right. Okay, thank you so much for answering these questions. Is this the first time you are having this pain, or you had it before, doctor? It's the first time. All right. Any medical conditions? No, doctor. Any allergies? No, doctor. Any family history of chest pain, John, or any heart problem? No, doctor. Or yes, doctor. My brother, he had stroke. Oh, that's really sad. So how's your brother doing, doctor? He died 2 years ago. Oh, please accept my condolences. I'm really sorry to hear about that. So you have to reflect whatever the patient says. This is what you have to do in PLAB 2, nothing else. Okay, all right. Moving on towards the next part, you have to talk about lifestyle. Let's talk a bit about your lifestyle as well. So, do you smoke? Yes, doctor. Do you eat healthy? Yes, doctor. By any chance, do you drink alcohol? No, doctor. You can skip IV drug abuse here. It's not necessary. But smoking alcohol is necessary here. Talking about medical history is necessary. Family history is necessary here. These things are necessary. You have to do that. All right. May I ask you, what do you do for a living? Do you drive? Because it's MI. You have to talk about driving. You have to refer the patient. You have to talk about DVLA as well. So, John, after doing the observations, I have your ECG with me, and I'm a bit worried because the ECG is not so good, John. I'm suspecting that you might be having a heart attack. What, doctor? Are you serious? Is it heart attack? What happens next? Well, John, basically, in this scenario, what happens in heart attack is the blood supply to the heart muscles is sometimes blocked due to narrowing of the vessels. But for it, John, we are going to admit you now to the ICU. Would that be okay for you? Okay, doctor, I can go for the admission. That's great, John. We are going to do whatever we can. We are going to involve the senior. I'm going to involve the heart specialist so that he can come and see you. Meanwhile, we are going to run some investigations, which include some specific blood tests and some cardiac enzymes as well, which are very necessary to be seen. Also, we are going to repeat the ECG. Would that be okay for you? So, in MI stations, we know a mnemonic, MONA. We know about it: morphine, oxygen, nitrates, and aspirin.
Yes.
You have to talk about it. It's the symptomatic treatment here which you have to talk. So you have this chest pain. I'm going to give you some um, uh, nitroglycerin spray, and also going to prescribe you some painkillers as well, which would be some morphine in this heart, because this pain is going to be very severe. That's why. Also, we are going to give you some aspirin as well. Would that be okay for you? Yes, doctor. So if we see a lot of ECG changes, John, if we see that your ECG is not getting better, then maybe we are going to going to do an ultrasound of your heart. Would that be okay? And then maybe we have to move on with a procedure in which we have to insert. If you get time, then you can talk about angioplasty. If not, then skip it. So yes, this is it.
Thanks.
Do you have any questions in mind?
Will I pass this station or how much I will get?
So, okay, don't worry about the passing station. This was a good station. Your history taking was good here. You were telling your IPS was good as well. But yes, don't act so casual when you are acting like a doctor, because these things are going to polish your IPS. If you are performing, then perform as if you are performing in the exam. You have to give your whole your IPS is going to get better with practice. The more you practice, the more good your IPS is, and obviously it's a natural thing. And when you are I wanted Dr. Insha to be the doctor because I wanted to see your maybe your non-verbal cues, which includes your hand movement. Whenever you are talking to a patient, you have to lean a bit forward, when patient is telling you some information, to show that you are listening very actively to the patient. So these are the things which you should show when you are like practicing in person. That's why when a person is performing on site, I prefer that a doctor on site should be the patient.
Thanks.
No problem. Other than that, Dr. Yasir was asking about that if we forget any step like blood investigations or anything like DESA, shall we fail? No, you're not going to fail. I had a station of psychosis. I quite remember what I did in the station. So I didn't ask about DESA. I forgot to ask about because in psychosis you have to ask about any drug abuse. That is necessary. You have to ask about alcohol smoking. I didn't ask about that because my 2-minute bell rang, so I skipped DESA. But I passed that station. I just got 3 number in my history, and other than that, I got like I passed the station because my IPS was good. That was like a telephonic consultation. Also, I did the management really well, so I got marks in that. So yes, you are going to be scored less in that section, but you are not going to fail. How are we supposed to cover ice in acute conditions like MI? So ice, covering ice is not an issue. I always suggest people, what I used to do and what we friends used to do when we were practicing is that after asking about the Socrates or OT para, and before moving on towards the differentials, I always used to ask about concern part. I don't know if you guys would have noticed, I ask about the concerns part like in between. I don't ask about the idea, expectation, and concerns before telling the diagnosis. I ask about the concerns earlier, then I ask about the ideas or expectations before the diagnosis or examinations. So it's always necessary to ask about that, and it's even in acute cases. In acute cases, you don't have to do the psychosocial, but in chronic cases, you do have to do the psychosocial. And acute conditions, you have to say it's the same. Like, okay, apart from the pain, is there anything else that is bothering you? So this is concern. You asked about the concern of the patient. So you have this chest pain. Do you have any idea what's the reason behind it? So this is idea. What do you expect from today's consultation? This is expectation. So this is how you ask about ICE and MI, Samara. Okay. So yes. Anyone else wants to ask any question? Okay, guys, thank you so much for joining in today. We are going to see you tomorrow. We'll be having Dr. May as well with us tomorrow. So see you guys tomorrow. Take care. Thank you so much, everyone, for performing.